Question 1. A 38-year-old female with chronic migraines presents with new-onset hemiparesis and dysarthria. What should the nurse do first? A. Administer prescribed sumatriptan. B. Notify the provider immediately. C. Reassure the patient and monitor. D. Review the patient's migraine diary. Answer: B. Notify the provider immediately. Rationale: new focal neurological symptoms, such as hemiparesis and dysarthria, may indicate a stroke, not a typical migraine. Administering sumatriptan could worsen a cerebrovascular event. Prompt notification is essential for timely diagnostic evaluation. Question 2. Which assessment finding in a patient with a migraine requires urgent intervention? A. Reports of photophobia and nausea. B. Visual aura lasting 15 minutes. C. Sudden onset of worst headache ever. D. Bilateral throbbing pain relieved by sleep. Answer: C. Sudden onset of worst headache ever. Rationale: this presentation suggests a possible subarachnoid hemorrhage or other intracranial pathology. It is a medical emergency and must be evaluated immediately. The other options are typical migraine symptoms. Question 3. The nurse receives 4 patients with migraines. Who should be assessed first? A. A patient who has had a headache for 4 hours with nausea. B. A patient reporting vision loss and neck stiffness. C. A patient who vomited twice after sumatriptan. D. A patient with a history of migraines awaiting discharge. Answer: B. A patient reporting vision loss and neck stiffness. Rationale: vision loss and neck stiffness could indicate meningitis or increased intracranial pressure. Both are critical. The others are expected migraine symptoms or less urgent. Question 4. A nurse is precepting a student caring for a patient on propranolol for migraine prevention. Which action by the student requires intervention? A. Checking blood pressure before administration. B. Holding the dose for HR of 52 BPM. C. Teaching the patient to avoid abrupt discontinuation. D. Administering the dose during an acute migraine attack. Answer: D. Administering the dose during an acute migraine attack. Rationale: propranolol is for prevention, not treatment of acute attacks. Using it during an acute phase shows misunderstanding. The other actions are appropriate. Question 5. A patient taking sumatriptan reports chest tightness and pressure. What is the nurse's most appropriate action? A. Explain that it is a common side effect. B. Administer oxygen via nasal cannula. C. Stop medication and assess cardiac status. D. Encourage deep breathing exercises. Answer: C. Stop medication and assess cardiac status. Rationale: sumatriptan can cause coronary vasospasm. Chest pressure must be evaluated to rule out myocardial ischemia. Patient safety takes priority over reassurance. Question 6. A nurse is caring for a patient who self-administers ergotamine for migraine. Which finding is most concerning? A. Cold, pale fingers and toes. B. Nausea and vomiting after the second dose. C. Headache persists 6 hours post-dose. D. Tingling in the scalp and neck. Answer: A. Cold, pale fingers and toes. Rationale: these symptoms may indicate peripheral vasoconstriction or ischemia, a serious adverse effect of ergotamine. Other options are common side effects or expected. Question 7. What is the nurse's priority when teaching a patient starting topiramate for migraine prevention? A. Report any mood changes or suicidal thoughts. B. Take with food to avoid GI upset. C. Avoid caffeine and chocolate. D. Keep a headache diary. Answer: A. Report any mood changes or suicidal thoughts. Rationale: topiramate has a black box warning for suicidal ideation. Patient safety requires prioritizing this teaching. The other choices are helpful but not urgent. Question 8. A patient with intractable migraines expresses frustration and hopelessness. What is the nurse's best initial response? A. Refer to psychiatric evaluation. B. Ask if the patient has suicidal thoughts. C. Encourage medication adherence. D. Suggest relaxation techniques. Answer: B. Ask if the patient has suicidal thoughts. Rationale: direct assessment of suicide risk is critical. Emotional distress in chronic pain may lead to suicide, so this must be addressed before other supportive measures. Question 9. Which task is appropriate for the nurse to delegate to an experienced LPN caring for a patient with a migraine? A. Teaching side effects of triptans. B. Assessing for aura symptoms. C. Administering prescribed analgesics. D. Evaluating effectiveness of treatment. Answer: C. Administering prescribed analgesics. Rationale: LPNs can administer medications. Patient education and evaluation of effectiveness are within the RN scope. Assessment is also the RN's responsibility. Question 10. The nurse receives shift report. Which migraine patient should be seen first? A. A patient who received morphine 20 minutes ago. B. A patient reporting numbness in one arm and slurred speech. C. A patient with a history of cluster headaches requesting oxygen. D. A patient vomiting after oral medication. Answer: B. A patient reporting numbness in one arm and slurred speech. Rationale: these could indicate a stroke or complex migraine with neurological involvement. Immediate assessment is needed. Question 11. Which intervention should the nurse include in the plan of care for a patient hospitalized with status migrainosus? A. Encourage light exposure to reorient circadian rhythm. B. Administer abortive therapy as soon as symptoms worsen. C. Monitor for signs of increased intracranial pressure. D. Provide cognitive behavioral therapy daily. Answer: C. Monitor for signs of increased intracranial pressure. Rationale: status migrainosus may be associated with complications like cerebral edema or increased ICP. The other options are incorrect or not urgent in acute care. Question 12. A patient refuses migraine medication due to fear of side effects. What is the most ethical nursing response? A. Administer the medication anyway. B. Notify the provider of the refusal. C. Provide full information to support informed decision. D. Document the refusal and discharge the patient. Answer: C. Provide full information to support informed decision. Rationale: respect for autonomy involves giving patients the information needed for informed choices. Forcing or ignoring refusal is unethical. Question 13. Which of the following is the most effective evidence-based intervention during an acute migraine attack? A. Aromatherapy and darkroom. B. Administering NSAIDs with antiemetics. C. Encouraging increased fluid intake. D. Positioning the patient upright. Answer: B. Administering NSAIDs with antiemetics. Rationale: combining NSAIDs with antiemetics like metoclopramide enhances drug absorption and relieves both headache and nausea. Other options are supportive but not primary interventions. Question 14. A patient taking valproic acid for migraine prevention develops tremors and confusion. What is the nurse's best action? A. Continue monitoring. This is expected. B. Give next dose with food. C. Notify the provider immediately. D. Reassure the patient and check vitals. Answer: C. Notify the provider immediately. Rationale: these signs could indicate valproic acid toxicity or hepatic encephalopathy. Immediate evaluation is needed. Question 15. A nurse is caring for a patient with a history of medication overuse headache. Which teaching is most appropriate? A. Continue using triptans with each headache. B. Avoid using acute meds more than twice weekly. C. Increase caffeine intake during headache onset. D. Alternate between OTC and prescription meds. Answer: B. Avoid using acute meds more than twice weekly. Rationale: overuse of triptans, NSAIDs, or analgesics more than twice a week can cause rebound headaches. Limiting frequency is key to preventing this. Question 16. Which dietary habit should the nurse advise the migraine patient to avoid during discharge teaching? A. Regular intake of dairy products. B. High sodium foods with MSG. C. Whole grain cereal. D. Lean protein sources. Answer. B. High-sodium foods with MSG. Rationale. MSG, nitrates, and tyramine-rich foods can trigger migraines. Teaching should emphasize dietary triggers. The other choices are generally safe. Question 17. A patient with migraines is requesting opioid medications despite other options. What is the most appropriate response? A. Opioids are not typically effective for migraines. B. We can offer whatever works best for you. C. Let's schedule you for addiction counseling. D. We'll administer the opioids just this time. Answer. A. Opioids are not typically effective for migraines. Rationale. Opioids are not first line for migraines due to poor efficacy and risk of dependency. Educating the patient is essential. Question 18. The nurse recognizes which patient report as consistent with a classic migraine? A. Sudden, bilateral sharp pain. B. Pulsating pain with aura and photophobia. C. Headache that improves with movement. D. Dull pain that worsens in the evening. Answer. B. Pulsating pain with aura and photophobia. Rationale. Classic migraines often involve a pulsating headache, aura, and sensitivity to light or sound. Other presentations do not match. Question 19. A patient on amitriptyline reports dry mouth, urinary retention, and dizziness. What should the nurse do first? A. Discontinue the medication. B. Administer anticholinergic reversal agent. C. Notify the provider of anticholinergic symptoms. D. Reassure the patient that these are mild. Answer. C. Notify the provider of anticholinergic symptoms. Rationale. These are expected, but possibly dose-related effects. The provider should assess for dosage adjustment or alternative treatment. Question 20. During discharge teaching, which statement by a patient with migraines indicates a need for further education? A. I should track my triggers in a diary. B. I will take my triptan after the pain gets severe. C. I'll avoid wine and chocolate as advised. D. I'll let my provider know if I feel chest pain. Answer. B. I will take my triptan after the pain gets severe. Rationale. Triptans are most effective when taken early in the migraine process. Delaying until severe pain can reduce effectiveness. Question 21. A patient with chronic migraines is prescribed topiramate, which finding warrants immediate follow-up. A. Weight loss of 4 pounds over 2 weeks. B. Tingling sensation in fingers. C. Sudden blurred vision and eye pain. D. Occasional dizziness after standing. Answer. C. Sudden blurred vision and eye pain. Rationale. Sudden visual disturbances and eye pain may indicate acute angle closure glaucoma, a rare but serious side effect of topiramate requiring urgent intervention. The other options are common and expected side effects, but not emergent. Question 22. A nurse receives 4 calls from patients with a migraine history. Which patient should be seen first? A. A 40-year-old reporting mild nausea and a dull headache. B. A 35-year-old with unilateral vision loss and confusion. C. A 50-year-old requesting a refill for their triptan medication. D. A 28-year-old reporting photophobia with a pulsing headache. Answer. B. A 35-year-old with unilateral vision loss and confusion. Rationale. Neurological deficits like vision loss and confusion could indicate a more serious condition, e.g., stroke or hemiplegic migraine. This is a priority scenario. Others are stable or routine. Question 23. Which nursing action is inappropriate when caring for a patient receiving 4-dihydroergotamine for migraine? A. Monitoring for peripheral ischemia. B. Administering with concurrent triptan therapy. C. Assessing BP during infusion. D. Monitoring for nausea and vomiting. Answer. B. Administering with concurrent triptan therapy. Rationale. Combining ergotamines with triptans can cause vasospasm or severe hypertension and is contraindicated. Monitoring for side effects is appropriate. Question 24. A patient with chronic migraines reports using butalbital-acetaminophen caffeine daily. What is the nurse's best response? A. This medication is safe if taken at onset only. B. You may increase the dosage during stress. C. Using this daily can worsen your headaches. D. Continue it until your next neurologist visit. Answer. C. Using this daily can worsen your headaches. Rationale. Overuse of combination analgesics, like butalbital, can cause rebound headaches and dependence. Daily use must be discouraged. Question 25. Which statement by a patient using sumatriptan requires further teaching? A. I take it when I feel the aura coming on. B. I can take another dose if the headache returns in 2 hours. C. I use it for prevention before stress events. D. I avoid using more than 2 doses in 24 hours. Answer. C. I use it for prevention before stress events. Rationale. Sumatriptan is not used prophylactically. It's a rescue medication for acute attacks. The other statements are appropriate. Question 26. During discharge teaching, which instruction is most important for a patient starting propranolol for migraine? A. Call if your pulse drops below 60 bpm. B. Take this medication only when headaches begin. C. Avoid dairy and grapefruit while taking this drug. D. Skip a dose if your headache is gone that day. Answer. A. Call if your pulse drops below 60 bpm. Rationale. Propranolol is a beta blocker that can cause bradycardia. It is taken daily, not PRN. Grapefruit and dairy interactions are not common concerns. Question 27. A nurse preceptor is reviewing documentation for a patient with suspected migraine. Which entry needs correction? A. Patient reports nausea, photophobia, and throbbing pain. B. Administered for metoclopramide and monitored for dystonia. C. Instructed patient to continue aspirin 325 milligrams daily for prevention. D. Notified provider of aura with speech difficulty. Answer. C. Instructed patient to continue aspirin 325 milligrams daily for prevention. Rationale. Aspirin is not routinely used for migraine prevention. It's more commonly used for stroke or cardiovascular prevention, not chronic migraine. Question 28. Which patient teaching point is essential when starting amitriptyline for migraine prevention? A. You may stop this medication once headaches improve. B. It may take several weeks to see full benefits. C. Take it in the morning to avoid drowsiness. D. This medication may cause weight loss and insomnia. Answer. B. It may take several weeks to see full benefits. Rationale. Tricyclic antidepressants like amitriptyline require weeks to show full therapeutic effect. It causes drowsiness and weight gain, not weight loss. Question 29. A nurse is teaching a patient with menstrual-related migraines. Which suggestion is evidence-based? A. Take NSAIDs only when you have pain. B. Consider magnesium supplementation during menses. C. Oral contraceptives worsen all migraine types. D. Avoid triptans since they are not effective here. Answer. B. Consider magnesium supplementation during menses. Rationale. Magnesium has been shown to help with menstrual migraines. Triptans can still be effective. NSAIDs should be taken prior to onset in predictable patterns. Question 30. A nurse is reviewing medication history for a migraine patient. Which medication is most concerning? A. Isocarboxazid. B. Acetaminophen. C. Ibuprofen. D. Ondansetron. Answer. A. Isocarboxazid. Rationale. Isocarboxazid is an MAOI, and it has dangerous interactions with triptans, possibly leading to serotonin syndrome. Others are commonly used. Question 31. A patient on valproic acid reports new tremors and confusion. What is the priority action? A. Reassure the patient these are expected side effects. B. Administer a dose of diphenhydramine. C. Hold the medication and notify the provider. D. Check glucose levels and continue drug. Answer. C. Hold the medication and notify the provider. Rationale. These symptoms may suggest valproic acid toxicity, which needs immediate intervention. The drug should be held and the provider informed. Question 32. A nurse delegates vital sign monitoring for a migraine patient on 4-metoclopramide. Which instruction is correct? A. Report any drop in temperature. B. Monitor every 4 hours unless patient is sleeping. C. Notify me if patient develops muscle stiffness. D. Skip pulse if BP is within normal range. Answer: C. Notify me if patient develops muscle stiffness. Rationale: metoclopramide can cause extrapyramidal symptoms such as rigidity. This is a high-risk side effect. Question 33. A patient is admitted for intractable migraines. Which collaborative intervention requires immediate nursing advocacy? A. Neurology consult for Botox treatment. B. Order for meperidine IM every 4 hours PRN. C. Referral to behavioral therapy. D. Trial of new triptan medication. Answer: B. Order for meperidine IM every 4 hours PRN. Rationale: meperidine is not recommended for migraines due to risk of dependency and CNS toxicity. Nurse should advocate against this option. Question 34. The nurse is caring for a pregnant patient with migraines. Which action is most appropriate? A. Administer ergotamine at onset of aura. B. Educate on relaxation and hydration techniques. C. Recommend topiramate as prophylaxis. D. Apply hot compresses to the abdomen. Answer: B. Educate on relaxation and hydration techniques. Rationale: non-pharmacologic methods are first line in pregnancy due to teratogenic risks with drugs like ergotamine and topiramate. Question 35. A patient with migraine presents with aphasia, hemiparesis, and facial droop. What is the nurse's first action? A. Perform a focused neuroexam. B. Notify the provider immediately. C. Give prescribed sumatriptan. D. Reassure patient of migraine symptoms. Answer: B. Notify the provider immediately. Rationale: these symptoms mimic a stroke and warrant urgent evaluation. Administering triptan without ruling out stroke could be harmful. Question 36. A new nurse asks when to give abortive therapy for migraines. What is the best explanation? A. As soon as aura ends. B. Once the headache pain reaches maximum. C. At the very first sign of migraine symptoms. D. Only if over-the-counter meds fail. Answer: C. At the very first sign of migraine symptoms. Rationale: abortive therapy is most effective early, ideally before peak pain. Waiting reduces effectiveness. Question 37. Which dietary habit should the nurse address in a patient with frequent migraines? A. Drinking decaffeinated green tea. B. Consuming aged cheese and red wine. C. Eating high-protein meals. D. Drinking 2 liters of water per day. Answer: B. Consuming aged cheese and red wine. Rationale: tyramine-rich foods like aged cheese and red wine are well-known migraine triggers. Question 38. Which nursing assessment is most critical before giving sumatriptan? A. Pain rating on a 0 to 10 scale. B. History of seizures. C. Blood pressure and cardiac history. D. Presence of photophobia. Answer: C. Blood pressure and cardiac history. Rationale: triptans are vasoconstrictors, contraindicated in cardiac or uncontrolled hypertensive patients. Question 39. A nurse is caring for a patient with cluster migraines receiving oxygen therapy. Which action ensures safe administration? A. Set oxygen to 2 liters per minute via nasal cannula. B. Use humidified oxygen via face mask at 15 liters per minute. C. Administer via non-rebreather mask at 5 liters per minute. D. Use room air only until patient stabilizes. Answer: B. Use humidified oxygen via face mask at 15 liters per minute. Rationale: high-flow oxygen, 12 to 15 liters per minute, via face mask is effective in cluster headaches. Nasal cannula flow is insufficient. Question 40. A patient is receiving 4 magnesium for status migrainosus. Which finding should the nurse report immediately? A. Decreased deep tendon reflexes. B. Warmth and flushing. C. Drowsiness after infusion. D. headache relief in 10 minutes. Answer: A. Decreased deep tendon reflexes. Rationale: this may indicate magnesium toxicity, which can lead to respiratory depression and cardiac issues. Immediate reporting is essential. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.